Hello guys, in this video we'll discuss about the algorithm for the management of acute diarrhea. So this is taken from Harrison's book of internal medicine. So here for any case of acute diarrhea we'll first take the in detail history and physical examination. After taking history and physical examination, we'll try to rule out whether the diarrhea is likely due to some infection or it is due to some any other non-infectious etiology. If it appears to be likely non-infectious, then we will evaluate non-infectious causes of diarrhea and we will treat accordingly. So for any cases of acute diarrhea, initially the history and physical examination is needed. After history and physical examination, we will rule out whether it is likely be due to any other infection or it is due to be some other non-infection. Then we will evaluate and then we will rule out the non-infectious causes of diarrhea and we will treat accordingly. Coming to infectious causes of etiology, if some from the history and physical examination, if we found out the diarrhea may be due to infection, then the infectious etiology is again categorized into three types. That is, if it is mild, that is the unrestricted, it is not at all obstructing the normal activities of the person, and second one is moderate if the activities are altered, and third one is severe if the diarrhea is so severe that the patient is debilitated. Incapacitated means debilitated person. Then we will go for, in all these three patients we will go for fluid and electrolyte replacement. This is the first treatment in any case of infectious etiology, whether it is mild, moderate and severe. We will go for fluid and electrolyte replacement. After fluid and electrolyte replacement, we'll observe the patient. If the patient symptoms resolves, then it is okay. If the symptoms persists, then we'll go for furthermore evaluation. And if the patient with diarrhea also have some other symptoms, like if the patient with diarrhea has some other symptoms like fever of more than 38.5 degrees centigrade, or I'm sorry, 30 more than 38.5 degrees Celsius, or bloody stools, or increase in the fecal WBCs, that is in the feces if the WBC count is present, or if the patient is either immunocompromised or any elderly host. If the patient is having fever more than 35.5 degrees Celsius, or if the patient is having any bloody stools, or if the patient is having increased fecal WBC count, or if the patient is either immunocompromised patient, that is either the patient is suffering with HIV or diabetes mellitus or any other organ transplant recipients, or if the patient is an elderly host. If the patient have no other comorbidities like this, then we could start the patient on antidiarrheal agents. Note, if the patient does not have any of these symptoms, any of these symptoms in the patient, if the patient does not belong to any of these criteria, then we have to go for antidiarrheal agents. The antidiarrheal, and see whether the patient symptoms getting resolved with antidiarrheal agents or persisting. If the patient is resolving, then it's okay. If the patient symptoms is not resolving even after the starting of antidiarrheal agents, then we'll go for stool microscopy. And if the patient have fever, bloody stools, increased fecal WBCs, immunocompromised or elderly host, then also we'll go for stool microscopy studies. In the stool microscopic studies, like we'll go for gram staining and sometimes culturing of the organisms also. And in gram staining and in culturing of the organism, if the pathogen, the diarrhea causing pathogen is found, then we'll treat the treat the antibiotic, treat the bacteria depending upon the specific antibiotic treatment. Then we will treat the diarrhea based upon specific treatment will be targeted depending upon the pathogen which is found. If the pathogen is not found, then we will go for empirical treatment. That is, empirical treatment can be started with metronidazole. Here it is given there. Here the empirical treatment before evaluation can be treated with metronidazole and with quinolone. So for any case, initially we have to go for history and physical examination. By history and physical examination, if it is found to be infectious etiology and non-infectious etiology, if a non-infectious is found, then we will evaluate the causes of non-infectious causes of etiology, non-infectious causes of diarrhea, and we will treat accordingly. If the upon history, taking on history and on physical examination, if likely to be infectious, then we will whether the diarrhea is mild, moderate or severe, that is the patient is debilitated, then we will institute fluid and electrolyte replacement, and we will observe the patient. If the patient resolves, then it's okay. If the symptoms persist, and then we will go for stool microscopic studies. And if the fever along with if the patient is having diarrhea along with that of the other symptoms like fever more than 38.5 degrees celsius and bloody stools and increased wbc count, and the patient belonging to some immunocompromised patient or any elderly host, if the patient belong to these criteria, if the patient have any of these above said things, then we will go for again stool microscopic studies. And if the patient does not have any of these, then we will start the antidiarrheal agents. And if even on starting of antidiarrheal agents, if the patient symptoms does not resolve and even it still persists, then we'll again go for stool microscopic studies. In stool microscopic studies, if the pathogen is found, then we will select the specific treatment. Then we will treat then we will give the specific antibiotic targeting the specific pathogen. If pathogen is not found, then we will go with empirical treatment. What is the empirical treatment for diarrhea? Empirical treatment will be given as metronidazole, and we'll start with metronidazole and quinolones. So, uh, like it if found useful, and share it with your friends. Thank you.